Therefore, I'm guilty of letting a throwaway comment potentially adversely affect the future health of a client. Someone has decided that they're just going to look at a picture. They're going to discount the person. Okay, they're not going to talk to the person. They're just going to look at a picture and say, no, it's fine. An interesting case this week was a person who's had a long history of low back problems. They've had previous MRIs and it came up that they do have disc protrusions in their low back. They're fairly young, they're under 22, and they've had medication. They've come to see me for some treatment, chiropractic treatment, which we didn't really get too far with it, to be honest. We had a few spikes of improvement, but overall things stayed pretty much the same. You need to know when to stick or twist. So we twisted, and we need to get maybe more up-to-date MRIs, even though these weren't particularly old, and perhaps get an opinion about whether to have some sort of injection therapy, something different, because unfortunately this person was at the point where they're unable to do any sort of movement exercise, even at a very, very low level, because of the pain and discomfort they're experiencing. So if you can't do that, then you have to get some sort of helping hand to almost kickstart the engine and get things going. So going for a guided injection into the problem area seemed to be the best course of action. Did have to fight for it, to be honest. It wasn't an easy sell, but eventually, after some very enthusiastic encouragement from the client's parent, they managed to get the injection, which did help mildly for a set period of time, not particularly long period of time. It did allow them to start their rehab, which was the goal behind the injection, but unfortunately, fairly soon after, they were back to square one again. So we start the loop again. Back to see a GP. GP is recommended to go and get osteopathy or physiotherapy treatment and swim. Now, unfortunately, this client cannot swim. Always know your clients, know their strengths and their weaknesses. But going back to osteopathy and physiotherapy just felt like a backward step to me, because we've been there. You know, it's not the first time with me. They'd had treatment elsewhere, and they hadn't had any progress of sort, which is why we looked for the injection to see if that would kickstart things and get things going. Unfortunately, it didn't. What was interesting was a few things that were reported during the meetings. One thing was the surgeon looked at the image of the MRI and they said, nope, this isn't too bad. You don't need any injection for this. They didn't take into account anything about what my client had been going through, as far as what they've been doing for the last 18 months. This person has had their quality of life cut to ribbons over the last 2 years because of this problem. And someone has decided that they're just going to look at a picture. They're going to discount the person. Okay, they're not going to talk to the person. They're just going to look at a picture and say, no, it's fine. Now, we know from a research point of view that if you take any neurosurgeon, doctor, chiropractor, physiotherapist, osteopath, anyone, and you sit them in a room with a written case history and the examination findings, and then you tell them to go into another room where there's a host of MRIs or X-rays up on the wall, and you say match the history and examination to the imaging, nobody has ever been able to do it reliably, ever, in the history of ever. Okay, so for somebody who's very well trained and very experienced to look at a picture and say, well, that tells me all the information I need to know, I'm not sure where they're coming from with that. That's disappointing, and why we shouldn't, as clients, as patients, as yourselves, if you're suffering with pain, discomfort, don't be so keen to go straight to X-ray, MRI, ultrasound scans. I'm a sonographer, so I know what sonography can do, but I also know when is best to use it. And also, if I find something that doesn't match with the history in the examination, then it pretty much gets ignored. We note it, but it's ignored as far as the importance for the case is concerned. This is a person who has a disc problem. So anyone out there who knows how effective McKenzie extension exercises can be, you lay on your front and slightly extend yourself in order to take the pressure off of the disc. They said, stop laying on your front, it's shortening the muscles in your back, and that's causing you problems. Now, I challenge you all out there to find me reliable research evidence that laying on your front for a few minutes, multiple times a day, shortens the muscles in your low back. That's your homework. Go. What's more likely to be happening there with those muscles in the low back is this person has been in chronic pain, long-standing pain for over 2 years. So it's a long time. What the body does is if there's a problem, if something isn't working as it should do or something's injured, that message goes to the brain. So the input goes into the brain and the brain will say, protect. So it'll protect it. And what does it do to protect? Muscle spasm. Okay, so the muscle spasm is to restrict the movement and the power available to the low back. Same thing in the ankle. If you sprain your ankle, you hurt your foot, you will limp and you will take weight off of that foot. That is how the brain helps you to protect that ankle or that foot. These are very highly trained people, very well respected, and rightly so. But what we need to do as clinicians, we have a responsibility to make sure that the words that come out of our mouth aren't just our throwaway opinions. They're based on research, they're based on fact, and something that we can prove beyond a reasonable doubt. Think of it like a courtroom. If someone came in and said to you, prove to me that when I lay on my front for a few minutes a day, multiple times a day, it shortens the muscles in my low back. Go. I've got no defense. Therefore, I'm guilty of letting a throwaway comment potentially adversely affect the future health of a client. And you as clients must always question things. Don't just take our word for it. Make sure you test us. If it doesn't sound right, go away and research it yourself or question the person straight away. We're not infallible. We don't know everything. It's a good learning opportunity for us, if nothing else, to understand that we can't just say things and expect it to just be forgotten. And we'll see you in the next video. Bye-bye.